Good morning, everyone, and welcome to Breakfast for Champions. My name is Tracy Lamb. I'm the Director of Programs and Communications at Partners in Diversity. Thank you so much for choosing to be with us this early in the morning. Our topic today is policies that put people first. And I'm really excited to have 5 amazing champions of diversity, equity, and inclusion here today as our panelist and moderator. But first, I want to get to a few housekeeping items. For logistical reasons, the chat box has been deactivated. There will be time at the end for Q&A with our speakers. So use the Q&A box to send your questions directly to our speakers. And you can post your questions at any time. This session is being recorded and will be sent to attendees shortly after the event. And also, today's program is being live captioned by LNS Captioning. So to activate that feature, simply hover over the bottom of your screen where you'll see the CC icon. Click it, and then you'll be able to access some of the captioning options that are available to you. And excuse me, today's program is part of a new series of programs dedicated to helping you, our members, navigate through our recent health, economic, and social justice crises with an equity lens. We would like to invite you to some of our upcoming programs. October is National Disability Employment Awareness Month. So on October 15th, in honor of that month, our Breakfast for Champions topic will focus on the intersection of race and disability. The program is sponsored by Tillamook County Creamery Association. On October 21st, Equity Conversations, in partnership with Care Oregon, will discuss healthcare inequities in the workplace and what employers can do to support the well-being of employees of color. And then on November 24th, mark your calendars because Say Hey is back in virtual form. We are going to welcome a new group of professionals of color who recently relocated to our area. As many of you know, we've been on hiatus because of the pandemic, so we are really excited to be able to bring you our first virtual Say Hey. So mark your calendars, November 24th, and I hope to see all of you there. Now, excuse me, now I want to introduce you to our Executive Director of Partners in Diversity, Mari Watanabe.
Good morning, everybody. I'm trying to get my camera to turn on. Could someone start? Oh, there we go. Okay, hello, everybody. Good morning. It's glad to see you, all of you here. Thank you again for being here. We're really excited to have this panel. I love this group of people. And though, again, we can't physically get together, I hope you're having breakfast with us and maybe some coffee. I'm having my coffee too. So I hope this morning's session will inspire you to make meaningful changes within your organization. As we have seen over the past several months, racial inequities are not random. They have been created and sustained over time. Since the beginning of the pandemic, more than 30,000 Oregonians have been diagnosed with COVID-19. And because of racial disparities, it is no surprise that our communities of color have been the hardest hit. Take a look at this slide. The blue represents the percentage of COVID cases in Oregon by racial or ethnic groups. The orange is the percentage of total state population within that group. You can see that the cases of COVID among the Native Americans, Pacific Islanders, Blacks, and Hispanics exceeded the percentage of the state population. We're also seeing how racial injustice plays out in the workplace that affects the overall health and well-being of employees. A study Partners in Diversity released in July showed that only 12% of employees of color surveyed said their organization was diversity friendly. And as a matter of fact, 74% reported some type of discrimination at work, 70% felt they were tokenized, only 9% agreed or strongly agreed that their organization puts a lot of time or money into diversity initiatives. And I want to thank Oregon Community Foundation and PGE for helping us fund this research. These inequities will not go away on their own. We must all do our part to change policies, programs, and practices that are perpetuating inequities. This is why I'm so pleased to have our amazing group of panelists this morning to discuss policies that put people first. So I'd like to introduce you to our speakers. Our moderator today is Dr. Karen Edwards. Dr. Edwards is the president of Clark College. She is responsible for providing vision and strategic direction for the college. Dr. Edwards has more than 35 years of experience in higher education administration and has championed diversity, equity, and inclusion throughout her career. She serves on a number of boards, including Portland Community Reinvestment Initiatives, our own Partners in Diversity Leadership Council, the Oregon Zoo Foundation, Northeast Portland Housing Oversight Committee, and Oregon Association of Minority Entrepreneurs. Joining her on the panel is Nadia Hasan. Nadia is an HR professional, former teacher, and mother of 3 young children. Her work experience includes teaching in Beaverton schools and working for companies like Nike, Warner Brothers, and Fred Meyer. She is passionate about building equitable systems that level the playing field with an unwavering commitment to inclusion through her, through better onboarding employees and employee engagement, recruitment, and retention programs. Next, we have Sharifa Johka. Sharifa holds the inaugural position of Oregon's Shakespeare Festival's Director of Equity, the first position of its kind established in the American Regional Theater, a position she has held for 5 years. Sharifa began her tenure with OSF in 2011 to lead the theater industry's largest professional development program called FAIR. Prior to OSF, Sharifa worked as an independent film and television producer. And I'm also pleased to introduce Charlie Norris. Charlie is the manager of workforce planning and inclusion for PeaceHealth, a nonprofit Catholic health system offering care to communities in the state of Washington, Oregon, and Alaska. Charlie leads the talent acquisition teams. He has also built and led the recruitment marketing teams that increase the PeaceHealth employment brand. Excuse me, my frog is still in my throat this morning, and increase the attraction of qualified talent. Next, we have Serena Stoudamire Wesley. Serena is the Chief Culture Change Officer at the State of Oregon Department of Administrative Services. Previously, she was the Director of the Youth Development Division. She has served in leadership positions with state government since 2014, including the Director of Diversity, Equity, Inclusion in the Office of Governor Kate Brown. So thank you all for being here. There will be some time for audience questions at the end. So as Tracy mentioned, go ahead and put them into the Q&A box. And for now, Dr. Edwards, I will hand things over to you.
Thanks so much, Mari. I want to thank you and all of the members of the staff, for Partners in Diversity for your continued support and advancement of diversity, equity, and inclusion in our business community. So much appreciate your unwavering efforts to advance this work and keep everybody current. So thank you. And thank you all this morning for joining us. I'm glad that you're able to be here, and I am honored to be in the presence of this distinguished panel here. I can't wait to get the conversation started. I will provide a little bit more context. Amari certainly has set the tone for it, but just to kind of give a status of where we are and then get in the conversation with our panelists. So this is from an article I've read, just kind of talking about where we are relative to the COVID virus. The sudden emergence of COVID-19 pandemic is dealing a severe blow to state economies, businesses, and workers. First and foremost, states have strengthened their healthcare capacity in the event that demand for medical services surge, which we've seen already. States are also restricting access to in-dining restaurants, theaters, concert halls, and some retail stores and other essential businesses, non-essential businesses, where large groups of people risk coming into contact with one another. Additionally, public health officials and experts have warned us to stay home as much as possible and avoid doing anything that requires close contact with others. Many other businesses have voluntarily closed to protect their employees and the public as a whole. Those exposed to the virus are being advised to self-quarantine for at least 14 days, presenting financial challenges for workers without paid sick leave, I'm sorry. These unprecedented challenges are having economic ripples across the country, and thousands of Americans unexpectedly find themselves out of work and causing significant increases in unemployment. States are taking action to address employment concerns facing Americans and to protect those who no longer are able to work. Some of the immediate issues on the minds of policymakers include expanding paid sick leave for workers, preparing state unemployment insurance benefits programs, and helping businesses transition to full-time telework. That's kind of where we are. And what is also happening, as Mari mentioned, particularly impacted by this situation, are low-wage, part-time, and workers of color. So the purpose or the goal for this morning's breakfast, for this morning's conversation, is to tap into the wisdom and knowledge of these panelists to help employers figure out, okay, how do we recover? And not only recover and go back to business as usual, but how do we recover and create a more diverse workforce for employers? So getting right into it, I'm going to start with some questions. And Charlie, may I start with you? Okay. What impact did the corona pandemic have on PeaceHealth from an employment standpoint, especially frontline workers who tend to be more diverse? And the second part of that question, and what did your organization do to families affected by COVID? And please include the process that your team arrived at solutions and who was involved.
During my introduction, Mari mentioned that we're located in Oregon, Alaska, and Washington. So we have over 16,000 employees. And so you can imagine how that impacts a workforce. And so one of the things that we saw was all of our primary care clinics, some of the elective surgeries, and even some of the emergency rooms basically dried up from an operational standpoint, and all the focus was on critical care and making sure that we had support around those departments so that, again, they could take care of the people that were being impacted by COVID-19. And so one of our goals was basically to keep everyone employed. And so we created these talent pools where people were basically doing things that may not be within their scope or their responsibilities, but it helped the cause in terms of keeping us moving forward and taking care of those patients that were in the critical care units. One of the other things that happened was our HR teams, our operational teams, and then benefits teams basically came together and started creating resources for our caregivers. And we call our employees caregivers. And so some of the things that we saw were, there was a focus basically on 4 areas. One of the areas was on spiritual care. And so we basically had chaplains that were doing rounding, one-on-one support groups, prayer meetings. We had mental and emotional health need resources through our employee assistant programs, virtual on-demand meetings with licensed mental health clinicians. And then we also provided resources for basic living. So connecting our caregivers, those people that were on the front lines, connecting them with services for daycare, food, healthcare, transportation, and housing for those that were impacted by COVID. And then another area that we focused on was financial assistance. And so we created what we call a Heroes Emergency Fund, and basically created this. It was a contribution from our foundation as well as some of our employees. And basically anyone that had been impacted, either they were sick or family members that were sick, could draw upon this funding. And so since April to current, there are over 600 employees that access that funding. And we distributed over $800,000 since April in that funding. And so other things that we did, we set up PTO cash outs. There was PTO banks, specific sick banks for COVID type of situations. There were early retirement fund withdrawals as well as loans. And then we had some enhancement in our benefits where if people went to a PeaceHealth clinic, and this is specifically coming out of the early COVID type of situations when we were trying to ramp back up, our caregivers or our employees were given opportunities to have the deductibles waived. Their co-pays may not have been in place for certain benefit plans. So all in all, there was a big effort to increase our benefits as well as keep people employed during that time period. And then lastly, we had our caregiver, we call our ERGs, caregiver affinity groups. And so those groups really started engaging with their members just to check in, see how they were doing, see if there were resources that, in essence, the company could provide. And so those were a few of the examples that we were able to put in place for those caregivers across our 16,000 employees and across all 3 states.
And by the way, special thank you for all of those caregivers and our healthcare workers across the region who we know made many sacrifices during this time. So just want to acknowledge that. Yeah, thank you. Thanks. Sharifa, how about let's hear what's happening in the theater entertainment industry. Can you share with us the extent to which COVID-19 affected the arts and theater? And tell us some of the difficult decisions the Oregon Shakespeare Festival had to make. You're on mute.
Thank you. Absolutely. As you can imagine, an art form like theater that is dependent on the communal experience to come together in a space and witness a live telling of a story, there was significant impact. It was an industry-wide shutdown. There was national stories that talked about, Broadway closing, an historical, situation that has never happened before. So like many of our peers across the country, we had to face the fact that the fundamental way that we do business was being challenged by a disease that did not allow for communities to come together. So we did not have a pathway that would allow for us to retain the 600 folks that are employed by us. We didn't have a pathway to utilize those skill sets. We, in addition to being a space where people have to gather, OSF is in a very unique situation where it's also a destination theater. So you don't have the engagement, predominantly folks getting into their cars and possibly measuring their own comfort level in their private spaces. With us, the majority of folks that engage with us have to decide to get on a plane, have to decide to go to a hotel, have to decide to really indulge in this sort of, travel aspect of the discretionary lives that we lead. And as we know, COVID shut all that down. So the direct impact that OSF endured was 90% of our staff were no longer employed. The folks who, create our stages, create our props, who build our costumes, who move those sets around, the performers who we often look to sort of be the sages in the space. There was nothing that we could do to move that process forward. So we found it was a devastating blow. And theaters had to begin to think about the fundamental way they do business. The only thing that began sort of like was a lighthouse or a beacon or a potential way forward were for those of us who were engaged in this conversation about wanting to create and increase access to our work through digital offerings. At OSF specifically, we were engaged in a deep dive around that conversation. And we were prepped to launch that initiative in 2021. COVID demanded that we lean into that much earlier. So what we did is we utilized some of the things that we had learned to date. We tapped on the skill sets of folks who already are in the organization, and we launched a digital platform called O. And that allowed us to engage storytellers, that allowed us to engage performers, that allowed us to engage with the audience members who found themselves, within their homes. It also opened up what we anticipated to audiences who could never make that ride to Ashland, who the physicality of that journey from the hillside to the economic challenge, it gave them an access point to the organization, which was thrilling. We just were saddened that the context was not as joyful as the discovery itself. But we are leaning into that discovery and are looking for not just the Band-Aid application of that work, but really the long-term application of how digital engagement increases access for folks to the artwork that we produce. And I think theaters across the country are debating this. Theaters across the country are asking themselves, how can we be the most resonant? How can we be the most effective? How can we be the most relevant? I was sharing with a colleague not too long ago that one of our peer theaters, the Penumbra Theater in Minneapolis, in the wake of all of not just COVID, but the other pandemic that we're aware of, the international crisis of racism that's leading to people, being killed in the streets. Penumbra, which was founded, by an African-American theater maker, Lou Bellamy, and is now led by his daughter, Sarah Bellamy. They decided, you know what? We have more to offer than just artistic presentations, which they still are committed to do, but they have redefined their entire entity. And now they're the Penumbra Center for Racial Healing. And they recognize that they have the capacity to not just share art, but to also deep dive into the conversation about structural racism and provide a respite for people of color artists who are not just engaged in art making, but is consuming art. So as arts institutions around the country, I think that's the question we all have to ask ourselves. How are we, in addition to supplying art, being culturally and socially relevant to the communities that need us the most?
That is so powerful, Sharifa. We think of therapeutic art maybe in a different form, but here you are through live art and storytelling, providing that healing to all people, but particularly those who are impacted both by COVID and racism. Kudos to you and to the industry for taking that turn and not just kind of throwing in the towel and say, it's not going to work for us, but finding a way still to repurpose your work. Much appreciate that. Yeah, I want to turn to Serena and Nadia as well. Both of you are in positions where you are certainly able to either create or influence policy. And so I'm going to ask you a question kind of around that. And the coronavirus has further exposed and exacerbated the many different inequities in our systems, including healthcare, education, the digital divide. I mean, we could list on and on and on what those are. The impact of the pandemic also confirmed what Ibram X. Kendi asserts, that there are no colorblind policies. Anyone who asserts that is not thinking it through clearly. Instead, the current systems and policies were fashioned in a white supremacist culture and designed to advantage dominant populations. Knowing this, what are some of the long-term and sustainable programs, policies, or practices you think need to be in place to create a more equitable workplace going forward?
Did I start? Okay.
There you go.
I think, first of all, thanks, Karen, and great to be here, and thank you, everyone, and good morning. First of all, it's not enough just to hire a DEI manager, director, or chief of cultural change, such as myself. I think one of the first things we need to do is look at our current policies, and they are built on race, especially in the state of Oregon, which we are the whitest state, one of the whitest states, but also our history was built on for the majority and not for people of color. And so we have to look at how do we change our current structures, and making sure that there's systemic change and that we're intentional about doing that. And changing our current structure, as people, we have to change, or the state has to change, because systems can't change themselves, people change systems. And so how do we go about that? And that's the question that we're all asking ourselves. Where do we go from now? Out of the ashes, where do we stand? And that's where we should be really looking at. And how do we enact systemic structural change as we're going forward to making sure that all feels like they belong and that we're inclusive of everyone. And I think that's one of the first places we need to start. So some people feel like if we hire a DEI director or manager that we've checked off the box, but we need not accept that because we are all more than just a check in the box. We have to move beyond that and say, okay, let's be strategic about the work that we're going to be doing as we start to move forward. And so that's where I think we need to look at. We need to start looking at the people, and we need to look at our systems and how we're going to make some structural changes as we're moving forward.
And I can jump in here on this. I think, some of the policies and practices that Serena's kind of talking about, we need to look at what does recruitment at our organizations look like, and what does retention at our organizations look like. And so we know that systemic racism has actually existed before 2020. And now, because suddenly folks have realized it, we're like, oh, we need to fix the systems and we're going to hire this person, but we're not talking about like the foundation of the system and the way that it was built. It was built to serve specific communities. And just on that recruitment kind of and retention perspective, I talk about three really specific things as a recruiter. So the first thing is the job description. So what is your job description asking for? What is your job description saying? What message is your job description sending? So if you've got like 10 requirements, and those are all the requirements, and we know that traditionally specific groups will apply despite being qualified, and then me, who's like the rule follower, and I was like, I didn't check all the boxes, I can't apply, so I'm not going to. We need to look at how we're designing and writing our job descriptions. Are we writing our job descriptions in a way that is welcoming people? And I've noticed language lately where they talk about, women and people of color are encouraged to apply. There's usually like a little kind of sentence about why that's so important. And so how are the jobs that we're posting, how are we writing job descriptions in a way that's inclusive and intentional? The second piece I would share is our actual posting of the jobs. So we do this like post and pray, like we posted, it's out there, like we posted on that website, we posted here, like what are we actually doing to intentionally find people that we want for that job? And so that's another thing that we really need to look at is this post and pray model, which is, if I wrote the job description really well, right, then maybe the right people will apply, but how am I actively posting this job in places where I want people, like the kinds of people that I want to apply? And then the third piece, which is a really big, like it's an overhaul, is our interviewing styles, right? So how are we interviewing candidates? Interviewing in itself is baked in sort of bias, inequity, lots of issues there, right? So is it a panel interview? We've had culture interviews or culture fit interviews, and that's not really the right language that we need to be using when we are looking at interviewing. And so I think really looking at our recruitment process from an equitable lens is something we need to start unpacking. I can't tell you how many times the hiring manager was like, I just got a really good feeling about him. And I'm like, tell me more. Like, how does that show up in like competencies? How does that show up in skills? And we all know that we've got some sort of bias. So how are we removing bias in our interview process? That I think is a very big lift for our organizations to start thinking about. I used to intentionally phone screen people so that I didn't have to meet them, because if I met you, I might really like you. And I want to like everybody, but at the same time, if I'm going to be equitable in my hiring, I need to really focus on the person, their qualifications, and their competencies to be able to do the job. So just unpacking diversity and inclusion from a recruitment lens, looking at your job descriptions, how are those being written, looking at where you're posting the job, and then really, really unpacking that interview process. Who's participating? How are we being inclusive in our interviews? How are we assessing people? Are we assessing on how we feel, or are we assessing on the ability for a person to do the job?
And Karen, can I add one other thing too? We talked about policies. We have, well, coming from the state, we have to look at the policies that our legislators are passing too, and how are people, constituents and stakeholders playing a role, and are their voices being heard through those policies too, if we're talking about from a policy standpoint, even before we get to the processes and the programs. So I want to make sure that to put that out there too is participate in the process. Participation is very important. And if we don't have a seat at the table, or if you don't just invite yourself to the table to participate in those processes and procedures and in those policies, then your voice won't be heard. So making sure, even if you have to push your way in there, make sure you have a seat at the table when those policies are being created. And now is the time to do that, more importantly than ever.
Yeah, I agree with you, Serena, and even having a voice in who is at the table is something that we can all do by voting. So I want to also make sure that we say vote.
Vote.
Your life depends on it, right? That's the mantra today. Nadia, I do want to come back to you, but I want to give Charles and Sharifa also a chance to talk about from that policy perspective. What can be done? What are we doing? How do we need to approach policy issues?
Sure, I can share. I mean, one of the things that we talk about at OSF is that we do this work from a social justice perspective. And oftentimes people misunderstand what that means. But essentially what that means is we're not looking to personally evolve people. Right. If people personally evolve along the way, that is great. That's fantastic. But that's their own personal journey. What we look at very specifically is the policies, practices, and procedures of the organization. So when you think about your mission statement, when you think about your value statement, what policy aligns with that statement that you profess to have? What procedure, what practice, what commitment internally, but part of your structure is a representation of that written mission? And that's what we continue to distill and drill down upon. So as new things emerge, as new policies are written, as new practices are in place, as new cultural norms start to root themselves, we have to interrogate, how does that represent this mission that we say that we have? How does that represent this value that we say that we have? Does this practice betray that value? Because if it does, you have to disrupt it, dismantle it, and recreate. And those are the practices that we deploy.
A couple of things I'd like to share. We're having to look at things through a different lens, and the lens that we're using is looking at it from an anti-racist standpoint. And so when we talk about that, you know, we quite honestly had to look at our skills and look at the talent that we have within our organization. And like many of you, you know, we have one of the top DEI leaders leading our work at PeaceHealth, Enrica Salonen. And for her to honestly say that, in my education, in my experience, there's a gap there in terms of dealing specifically with anti-racist practices, policies, and so forth. And so we're going to look for external help, you know, to help us with that strategic planning process, as well as to identify what are some of the anti-racist practices and what does that mean at PeaceHealth. And so specifically, we've worked on our workplace harassment policy, our EEO opportunity policy, and even our social media policy, and being very clear that says PeaceHealth has a zero tolerance for actions or words that are racist, hateful, or violent. And so we're being very clear in terms of that language within all of our policies.
Great, thanks. Nadia, I do want to follow up with you with regard to recruitment. There's some conversation as to whether you should list minimum qualifications and preferred qualifications, because particularly some folks who feel like I meet the minimum, but since you put the preferred there, that might be what you're really looking for. And I don't have all of the preferred, so I'm not going to be able to check all the boxes. How does that impact, how does that impact people going forth, even to make application for positions, and more specifically, people of color who may have, you know, all of the minimum qualifications, but I don't have the doctorate degree, or I don't have, you know, 15 years of experience. Do you have a position one way or another, whether we should include preferred qualifications in job announcements? And the other I want to ask also is about how do we make sure we include the organization's value statements? So people who are able to see what you value as an organization can determine, I share that value, and therefore, you know, I may be a good fit for the organization. So,
Yeah, so I guess I'll unpack the first one. So, you know, I want to really talk about required qualifications today. And I think we really need to unpack as what really is required. We have expected people to go through this traditional pathway, right? You do this, and then you do this, and then you do this, and then you get the thing. And what we're realizing is that there are people who have a skill set to do a job, but they didn't go this way, right? They kind of went like this, they went like this. Their lived experience gives them a whole nother level. So to your question on values, like, we need to really start thinking more on those value statements, but also what are we counting lived experience for, and what are we counting sort of like traditional experience for? So I encourage folks when I work with them, especially at the job description stage, that's probably when I'm the most involved, is what are we putting here? Is this really a requirement? Why is this a requirement? Like, do we know people who could do this job that don't meet this requirement, and how should we be unpacking that? And so if you were to say preferred versus required, I would say step one, are your required qualifications truly required? And I've said this before in my teams. I've noticed that this person doesn't have this, but they're the same job, right? So really like looking at what is required and is it really required? If we are going to put in a preferred, which is going to be a little bit of what we want in required, but we're not putting in required, then I think we need some sort of statement. And so I'm going to pull up this statement that on my phone that I really liked. And it was a job that I had seen at one point, and it said, you know, studies have shown that women and people of color are less likely to apply for jobs unless they believe they meet every one of the qualifications as described in the job description. We are most interested in finding the best candidate for the job, and that candidate may be the one who comes from a less traditional background. We would encourage you to apply, even if you don't believe you meet every one of our qualifications described. If you are unsure about whether you meet the qualifications of this position or how this would be determined, please feel free to contact Human Resources to discuss your application. So that right there went from, oh, I'm scared, I don't know, I don't have the skills, to like, maybe I do, maybe I'll apply, maybe I'll throw myself out there. So just having that little, you know, I think that statement to me really speaks volumes. It makes me feel like, okay, maybe I can get a chance. And so if you want to really have these really strict requirements or these really strict preferred qualifications, if you preface it with that, I do think that, again, it gives people more like, okay, I think I'm going to go for this. I think I can do this job.
thanks.
Could not agree more. I really could not agree more, because we've all seen the template language. It basically looks like legalese that feels like obligatory and something you're just added on because the world said so. But something that's specific, that actually calls out a pattern and invites you into a process, I can imagine that yields a different result. Even hearing you read that out loud, I see a welcome to me. I see even if I discover that my instinct about my qualifications is correct, I already have a different understanding or impression about this organization. And I might keep them very closely, I might track them very closely to look for an opportunity that is indeed aligned with my qualifications, if I find that my initial suspicion was actually accurate after reaching out to them. So I've never seen a statement like that, so I actually love it.
Yeah.
Yeah.
And I would even add, sorry, so I just wanted to, I think there are a lot of people that's really scary for, right? So if I'm, you know, hiring manager, well, I did it this way, and this is how I got promoted, and I put my 10 years in. And so I think it challenges a lot of people and how they got where they are. And we really need to be intentional about that. Like, that's really great that you went that way, but we're going to look a little bit different. And I think that's where we start to see the push and the pull, because I've had hiring managers who are like, well, no, here are the boxes that I had to check to get here. I don't think that it's fair to have to do that. And so we really need to sit down and say, you know, has the traditional pathway always been the right way? And if it hasn't, how do we encourage people to say it's okay, that it's great that you did it this way, but we're going to do it a little bit different as well.
Mm-hmm.
Right, because we know that the traditional pathway did not work, and it did not get the results that it should have gotten. It didn't yield the results. And we need to have better, we need to have standardized recruitment and retention to mitigate the biases that we have, even on the interview panel. How do we train folks to leave their biases at home? But also have trained, getting other folks to understand, to come, when you come to work, bring your whole self. When you come to the interview panel, bring your whole self. Why should I have to change who I am? Because I shouldn't need to fit into your mold. It's about opening that box and working outside the box, because you won't get a good, you won't have diversity of thought if you don't. It'll just be the same old all the time, and change will never happen. And again, we go back to being intentional. And that is my theme for this year. When I took this job, I said my theme for the year is being intentional. And that means being direct, being intentional about what we're going to do so that we can get the outcomes that we need. And it's not going to happen overnight. And we need to stop with the performative gestures. Let me just say that. And let's just, we need to be real about that, right? Gestures, they're just temporary, they're reactive, and we're just doing it for today. But what's going to happen tomorrow? And how are we going to get to that root, that foundation, so that we can start to move things forward? So let's just leave the performative gestures at home, you know. And as you guys had someone here from Policy Link, a couple of months ago, that said the same thing. Performative gestures just don't work. They're just temporary. And we got to move beyond that.
Indeed. I know that statement that you read, Nadia, really speaks to the intentionality of Nike wanting a diverse workforce, right? It's not that you have to have this, this, and this in this order, but come on and apply anyway, because even if it's not this position, it might be something else. And we're looking for, you know, a variety of people. So I appreciate that. Charles, would you like to add anything to that in terms of how we are able to be more inclusive in our recruitment processes and achieve the diverse outcomes that we all say we're looking for?
You know, I too are familiar with the post and pray. And so one of the things that we've been trying to do, again, is be more intentional or targeted in our efforts. And so again, where we traditionally would maybe post on some of the popular websites, we're not getting the performance that we've typically done. And so, you know, we're leveraging referral programs. We're being very specific in terms of what colleges and universities that we reach out to. And then again, trying to brand ourselves. Even though we're located in the Northwest, one of the most difficult areas to recruit for diversity, we're trying to show our employment brand in communities that we typically wouldn't recruit from. And so again, in every effort that we're looking at, whether it's looking at management trainee programs, internships, and so forth, our new VP of talent and development, talent acquisition and development, is using the phrase max diversity. You know, and so again, if we have limited opportunities, we're going to maximize that opportunity and make that all diverse candidates, and just continue that, and that'll, you know, it'll slowly feed some of those pipelines and those opportunities for hiring people of color. But again, that's one of the ways that we're trying to be intentional is figuring out areas that we can be very targeted, very specific, and maximize diversity in all of our recruiting efforts.
Thank you.
Karen, can I be a little here, since we're supposed to keep it as conversational as possible? I just want to say the word targeted. Why do we have to use that word? Because I just think that we shouldn't target. It should just be something that we do. And I don't think it's hard to recruit Northwest. What I think it is that we have to change our structure, because we have so many HBCUs that we could be recruiting for that have the folks that we need. And now that we're working remotely, we see that it works now. So someone can be in New York, they can be down in Texas at Prairie View University, HBCU, or they can be at Howard. They can work from Washington, D.C. to get the work that we're doing, because we know what the new normal is. It's not that everyone's going to be coming back to the job 100%, at least for the next year or two, or maybe even longer. Some folks are going to just say, we can work remotely from now on. So why can't we do something differently in this new normal that we have? And say that this is what we do. This is what we do. We know that we're recruiting from everywhere. And so I just think that there are people here, even in our state of Oregon, who are just as qualified as anyone else that we can recruit from. We just have to say, this is part of our normal work. This is what we do. We work with this. It's about building those relationships and knowing that we're going to those nonprofits that do this and bringing other folks to the table, and not really just keep doing the same old, but we know that we have to do something different as we're starting to go forward. Again, we can't be reactive. We have to be strategic about what we're doing. So I'd rather use strategic about our recruiting efforts and not targeting. So that's just me.
I also just wanted to add to this conversation around recruitment and hiring, and just sort of uplift everything that people have said, and sort of revisiting some of the three things that even Nadia said, which I completely agree with. But when the only nuance I would add, when you're looking at the job descriptions, for example, in addition to really interrogating some of those requirements that we add, that's something that I had to deal with as I entered into the theater space, because that was not my background. But I saw that there was this desire to have, an MFA or experience with Shakespeare when I'm looking to hire a stitcher. And those are extraneous things when I'm looking for the core skill set of a prop artisan or a carpenter. But in addition to that, what we had to start doing is add the skill set of being able to do the work with an equity lens. And recognize that that's a skill set, and add the responsibility and expectations within the job description. So once you add that, you're paying for that skill set. But two, when you get to the hiring process and you begin to interview folks, you are building within that interview process a vetting mechanism to tease out someone's capability to enhance and continue to maintain the culture that you're building. You're asking them in all aspects of their job, when you're dealing with, this employee relations issue, how would you resolve this with an equity lens? You're asking this of managers and supervisors in the hiring process. And the other thing that sometimes people miss is it's not just the question that's important to ask, but it's also important to have in the space who is going to hear the answer and actually assess the accuracy of that answer. Sometimes what we do is we have, based on people's position, we assume that they're the ones that's best to vet. And what we have to figure out is, no, we have to broaden the people that we call vetters. And we actually need to prioritize the skill sets that are necessary to assess the skills that we're hiring for. So for example, if we're going to hire someone who's doing lighting design, then yes, let's get someone who has experience doing lighting design and ask some of those, programmatic questions with regards to lights. But if we want that person to come in and manage a team equitably, we need some people who had the lived experience of what it feels to be marginalized to assess the answers that those candidates are given. So thinking about the process holistically, thinking about that job description, add the skill set, be prepared to pay for it, to interview and vet for that skill, and ensure that the person listening to the answers actually has a skill set to assess that person's capabilities.
Mm-hmm.
I'll just add to that, Sharifa. I had a HR person that I worked with, and this is at Nike. They used to do panel interviews, so it was group interviews, and they moved away from that, and they wanted to do single. And there's the group think mentality where if Charles is my boss and he loves the person and I didn't, I might be like, okay, they were great, even though I really liked this other person. But one of the things my HR partner said at the time was like, I don't know if I trust some of these people alone, right? Like, not because they're the training that's required to know what you can and can't do gets really complicated. And so it was just a very interesting thought that we really need to be intentional about even what question seeking and listening looks like, because that in itself is a skill. So really breaking that down as well is very important. So thanks for sharing that.
Yeah. So we've hired the person, right? Or hired people. And Mari showed a slide earlier that talked about the retention of employees and professionals of color. And while onboarding is not the end all and be all to retention, it is a critical part. Share with us, what are you doing to help onboard? What kind of onboarding strategies, programs do you employ to help with the retention of employees of color?
I will just say, as a hiring manager at my previous position, I hired someone from out of state, and a person of color from out of state. And I think what was important for me in bringing them to Oregon from deep down south is to making sure that I connected them. So making sure that they're connected to the different organizations, and especially if those organizations are national organizations and they're here in Oregon, making sure that I connect them with that. So like their sorority or whatever organization they're a part of. And then also making sure, because for me, retention and recruiting goes hand in hand, and after you hire them, it doesn't stop that recruiting, that retention, and also adding on that succession planning. How am I going to keep them? How am I going to make sure that they get to grow, or they want to grow into where they want to be or where they need to be? And I think that's really important. But also making sure that I'm connecting them having that relationship with the community. I was able to do that several times with hires, and they're still there with the state. And so I think that's important. And then calling them. So the fires were started. I know that they live further down Southern Oregon. And so making sure I'm calling them, making sure they're okay, checking in, keeping that relationship going. And I think that's what's really important. We just can't bring someone here and leave them on their own. We have to stay in touch with them. We have to check on them. We have to support them. That's just part of that support and outreach, which is really important. And it has to be intentional, not just because you want them to stay here, but because you brought them here because you believed in them, you believed in their skills, you believed in what they could bring to you in the work that they're doing. So I think that's really important, and also to help with the growth of them and to lead into the other positions. So
one thing I'd like to add is this idea. So we've kind of unpacked this concept of like thinking outside of the box with our job description. I think that you get some pushback within the department. So if this department felt like Sharifa was the best fit and we brought Sharifa, but everybody wasn't on board because Sharifa didn't check all the boxes, her onboarding experience has already shifted because there's some people who are not super happy about that. So we need to really talk about unpacking the decisions that we make in hiring and ensuring that everyone's on board. And I've seen it happen over and over again across my entire career, where the person that was picked wasn't the one that everyone was excited about. And so you already saw sort of this tension. So starting to really break that down and looking at that. I think the other piece that I'd like to see more of is sort of surveying our new employees so we know what they need. And I'll share an example with you. It was about a year or two ago, and there was a mosque shooting in New Zealand, and several people were shot and killed. And I am a Muslim, and so that day was heavy, like very heavy for me. And I kept waiting for someone to say, "Are you okay? Like, how are you? What do you need?" And I didn't have connections with people at the time for that conversation to happen. And it's fine. I'm okay. But just knowing that the impact that had on my day at the time, and that fact that no one was really able to recognize that. I remember someone sharing like how the murder of George Floyd, like how about all the other ones before? No one was checking up on people then. So how are we intentionally checking up on our people in ways that talks to them? So that survey, like, what are you interested in? What are your passions? Like what drives you? Because once you really understand that, you do make someone feel really excited, and you do make someone feel really welcome. And then that retention does come with that.
What I can add, not connected to onboarding per se, because I can tell you that our onboarding still continues to be a challenge for us. None of us are satisfied with what happens right now when new employees join the organization. We've named it, we all have an itch about it, but we haven't quite solved it. But there is something that exists within the organization that still helps to be a resource for people, and it's the culture of affinity groups. So we very clearly and transparently encourage people to participate, join, or create an affinity group that speaks directly to what they may need in order to have a support system within the organization that is based on their identity. So, and that is acknowledged to be work time. We encourage that you meet during work hours. We pay for that because we are really clear that participation, if you're the leader of that group, if you're actually leading it and organizing it, you are investing and contributing to the organization. So, and as affinity groups also have the option to be, they define themselves for themselves, and they self-regulate how they're organized. Some are public and they're open to all staff members based on an identity factor. Some are private and they're deliberately private. Some are invitation only. they create their own rules based on whatever discussion, politic they want to be foremost in that space. That's how they define that space. And we strongly encourage folks that they create a system in which they're participating in these structures. And as groups emerge and they move from, as someone who participated in the POC group, as they emerge and they move from sort of self-healing spaces, because that's how the group started. Like, you know, we got injuries. So we were just dealing with some internal injuries. As you move from that space, you find inevitably strategic thinking emerges, and strategic thinking that sort of challenges the way that the org is structured, strategic thinking that changes policy and helps the organization overall, but also strategic thinking that moves into broader activities. We have a, you know, annual POC retreat that's funded by the organization that gives everyone a day that's paid, and literally your job that day is to retreat. So we have, you know, masseuses come in, we cater lunch and dinner, we play volleyball, we play water balloon fights, we go to wineries. It's whatever we decide to do that day. The LGBTQ group, they do, you know, an out weekend where they do drag shows. They do a whole lineup of programming that they decided that's what we want to do, you know, with our time and our resources. We now have a recently defined, you know, access group where they do access weekend, where they invite organizations, institutions, schools, theaters that are working with folks with disabilities. So people decide how they want to manifest any public, you know, display of their gathering, or if they want to continue a more insular, you know, quiet, private conversation until they're ready for a more strategic or celebratory space to be in.
And I'll just add one thing, like the paid piece that Sharifa said, that's really important, right? So what happens is a lot of us take on this emotional labor and we just do it because that's just what we've had to do for so long. And
that's
so
how it
really,
started. Yeah.
And so acknowledging
private.
that you're going to be, like acknowledging that.
Not announcing
paid.
yourself. Exactly.
And if it's in addition to your job, then somehow your job is still manageable for you and not in addition to that. And just really being intentional about that is so important.
Karen, and I'll add, our affinity groups too have been very helpful early in the process. So we're trying to integrate them more and more into the interview process, and then some of those offline conversations. So again, when a candidate is coming in and our leadership is, they understand that we have leaders within our affinity groups, maybe they're a part of those dinners. Like for leaderships and physician positions, a lot of times they have dinners just to talk about the community, talk about culture at PeaceHealth. And so again, having some of those affinity group leaders participate in some of those offline conversations, I think has been helpful in making the choice to move to PeaceHealth, to move to the Pacific Northwest. The other thing is again, during our orientations, we have invitations and information that talks about the different affinity groups. And then we have internal web pages that show all of the resources in terms of what the affinity groups have done, what they've accomplished, you know, and how, if they are interested in joining. But we want to be a little bit more intentional, because it almost feels like we have two cultures at PeaceHealth. One that is corporate, and that's where we get a lot of activity from these affinity groups, because some of the times for those events or for their monthly meetings are during the lunch hours or slightly after the lunch hours. And when the majority of our employees are bedside, you know, they don't have that flexibility. And so we've been looking for ways to make some of these resources accessible to them, the meetings accessible to them, and again, get them engaged in some of the affinity groups, and specifically from a retention standpoint as well. And so again, you know, just getting our caregiver affinity groups front and center. When people get onboarded, they have an opportunity to engage with mentors and do leadership development in those opportunities. And I think that helps from a retention standpoint as well. And some of the groups, we're probably going to look at the Partners in Diversity Retention Study and use that as an example to say, how can we strengthen some of our retention strategies as well, based on some of that data and research.
That's great, great. I'm going to give this one last question, and all of you, I hope you'll take advantage in providing an answer. The issues that we're talking about today are certainly not new. discrimination and racism in workplace and various industries. It's been raised now along with COVID that, it's been a pandemic for many, many years. Yet, because of COVID, people feel a sense of urgency now, and not just because of COVID, because of the social unrest that's happening in our country now. There's this sense of urgency. We got to hurry up and act, and we got to, mobilize and move into action, which good. Yeah, we do. We needed to do that a long time ago, but we have that sense of urgency now. And so my question to you, given this sense of urgency, how do we get organizations to engage in equity and anti-racist work? And as DEI professionals, please give your words of wisdom to organizations, especially those who are wading in this work for the first time. For those just starting out, which may be a little surprising, but there are some. How do we get people to understand, embrace this urgency, and more importantly, move?
There are a couple things I heard earlier that apply to us as well. One, there's no quick fix. It's going to take time, it's going to take effort, it's going to take leadership, and it's going to take resources. And when I think of resources, we were just talking about how do you monetize just leadership training. So if we were to take the 16,000 employees, say the average salary is $40 an hour, and just monetize that, it's about $640,000 for 1 hour training. That's where our leadership team, that's where our executive team has to step up and say, are we serious about this or not? And that's just one example. And so again, for us, we know it's going to be a journey. We know we're going to need help, and we know it's going to be an investment. And so as we continue to strategize around, what the future looks like, not only looking at the policies, not only training our leaders, but training our employees. And then I think we have to be very transparent with our employees as well, because in essence, they're holding us accountable. They want to see what are the results. We see all these other organizations. What does that mean here at PeaceHealth? So what are we doing? And so I think we have a great opportunity to communicate some of the things that we're doing and continue to provide updates to them. And so with our caregiver affinity groups, they really stepped up during this time period. They held town hall meetings where they not only talked about voter suppression, but they also started talking in very transparent ways how they face discrimination. And those specific situations were addressed. They were investigated, they were addressed, and there were results. And so when they see the company reacting or responding, if you will, to some of their concerns, I think, again, it'll help with retention, and it will change our culture in terms of how do we move forward in this environment and these times.
Karen,
I'm going to ask you, Serena, and I particularly because the title of your position for cultural change, I think also is loaded, and so would love to hear your perspective on it.
Because, and I'll just tell you a little bit about the title. When I was asked this position, I didn't want the title of DEI because I felt like it was limiting, and it became the new buzzword to make sure that and wanted people to make them feel like they're really into it and they follow the people and moving on. But I think we have to go with cultural change, especially if we're talking about anti-racism and belonging and inclusive. And we first need to understand that anti-racism is not diversity, equity, and inclusion. It's built in there. It's part of that whole cultural change, and it's about understanding what anti-racism is, because anti-racism doesn't get you diversity. The anti-racism is not equity and it's not inclusion. It's understanding that, and anti-racism needs to stop, whereas diversity needs to be more transforming. And how do we move it forward? It needs to be forward movement. And how does it involve everyone? We just can't be limited just to that. It's about changing a culture, how we think, what we're doing, how are we doing the work. It's about the recruitment and retention. It's about succession planning. It's about job descriptions. It's about contracting and procurement. How are we contracting with our stakeholders and with small businesses and large businesses, how are we doing with women and minority in that contracting and procurement? How are we doing things differently? It's about a culture change. We need to be changing how we're doing things. It's not just in this little bubble, but we need to step outside the box. We need to dance outside the box. We need to shout outside the box. But again, it's about being strategic and looking at everything that we're doing. We're looking at our contracting and procurement. We're looking at our hiring. We're looking at our succession planning. And if you look at the state, we're not just in up I-5 from Portland to Eugene. We're over in Ontario. We're over in Malawi, the Wallowas. We're everywhere. And a one size fit all doesn't work for us. How do we make sure when we're using our tools and methods that we're doing things that fit, and which I hate using the word fit, but where we go to that culture and when we go to those different areas, how are we making sure that we are doing folks? So I'll use Ashland, for instance. We should be on there. We can't do what we do in Portland down in Ashland. Some of the things will work, but not everything. Oregon is 70% rural. And a lot of folks don't understand that. And so what we do in Portland Metro, we can't do over in Springfield. We can't do over in Allowas because folks are different. Folks look different. Or I'll say that I made a call over to one rural county and they was like, oh yeah, we'll welcome you over here. Our demographics are starting to change. And I had to tell them, you do realize I'm not Latina, because I know that your Latino population is increasing, but your African-American population isn't. So that's not the same. And again, with racism, Black and brown people, we've been dealing with this well over 400 years. This is something that's not new. So a lot of folks, when we're talking about, oh, we're going to start doing this, man, we should have been doing this years ago. This is something that's not new. Let's be transformative with what we're doing. Let's look at some different things. How are we going to change some things? How are we going to bring some people in? So when I just started looking at how are we doing recruitment and retention, I brought folks in, external folks. So I'm just not talking to people that are inside, because if I'm inside of it, I'm not seeing what's happening. So I have to bring some folks from the outside to get those ideas. So people that are trying to get in, we can work on this together. Otherwise, we will just still have the same old, same old. And so being different, doing different, bringing the community inside to help us as we're starting to move forward makes a big difference. So yeah. I know that's a lot.
It's all good.
On my bandwagon, but I mean, you know, again, our systems have not changed, but the people within and around those systems have changed. So how are we meeting that change? How are we going to meet them and make sure that we can meet their needs, especially in service organizations and service companies? So I'll leave it at that and let someone else chime in.
Sharifa or Nadia, would you like to add?
Sure, I can. I think the first thing I would say is what Charles talked about, which is that commitment from leadership. So saying like we are intentionally and like thoughtfully choosing to commit to A, B, and C, and you won't be able to do everything. I know that you want to try, that's okay, start slow. Use Google. This sounds really silly. I can't tell you how many times people have asked me a question and I've gone back to, and I've been like, well, if you Googled that, right? Like, Google this or Google that. I saw some people asking about that job description, the one that I read. I don't actually remember. It was a school job that I saw somewhere and I just took a screenshot of it. So, you know, Google job descriptions to see what kind of job descriptions excite you, what job descriptions don't excite you. And then I think the biggest piece I would say is when you're sitting at a table, know that you'll be missing a voice, or you might miss a voice, or you might unintentionally miss a voice. And if you do, that's okay. Apologize and start over, right? So I've got this, like, I've gotten a lot of this defense of like, well, we didn't mean to. You know what? I know you didn't mean to, but like, here I am telling you left out this voice. So go ahead and just say sorry and let's get started. So there's this like sort of this defense mechanism if you look into like white fragility or fragility. And I think we just really need to say like, you know, I forgot Sharifa's voice at the table, like, dang it, Sharifa, I'm so sorry. I'd like to invite you back into this conversation. Not, oh, blah, 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 oh, blah, blah, blah. Oh, I don't have an excuse. We made a mistake. Please join us. And we'd really like to invite you to this conversation.
Yeah, I mean, just to pick up on that point, I tell people all the time, listen, when you start engaging in the work and you want to operationalize equity, it doesn't mean that you automatically become flawless. It doesn't mean that all of a sudden you do everything right. The idea is that your response time to correction decreases, right? So instead of me having to debate with you and argue with whether or not this structural, obstacle exists, you're so tuned in that you're ready to resolve it, as opposed to me having to convince you that racism is a thing, that sexism is a thing, that ableism is a thing, that heteronormative culture is problematic. You're already on the same page. And now we're just working on solutions. But to your question about like, what did they do? People who are, now curious because of this new urgent moment that we're in, I just want to borrow a slogan from Nadia's org, just do it. And approach it like you would any other problem. If you don't have the internal capacity inside, the skill set, expertise, look for it, either hire it, consult with it, and start the path. There is no one way to cook this meal. There is a million infinite ways to cook this meal. But you start with your mission statement. You start with your value statements. You look at, are we aligned? Is there anything about these statements that are aligned with our policies and our practices and our procedures? And start to interrogate the meaning of the words of that mission statement. Because I can tell you that me reading the mission statement of the organization with the lens of equity and charged with operationalizing values of equity. When I read that mission statement, it basically says we are committed to, diving into the humanity, the collective humanity of all people through the production of plays. There's a lot of layers in that for me, because I'm bringing analysis to it. And you can start with your mission statement. Ask someone either with expertise that you hire or consult with to help you tease out, where are the equity values already stated in my mission statement? And how do you actually raise them up? And what policies and procedures can be enacted immediately that are free, that reflect those things? And then you plan like you do anything else. You plan the horizon based on your resources and your plan for your organization to move those steps forward.
Yeah. Thank you for sharing that. The only thing I wanted to add to this too is that it has to be genuine. So again, as I think it was pointed out earlier, if you're just hiring a chief diversity officer to say you're doing diversity, that is not genuine. That's not a genuine commitment to it. And so as you launch into this work, there's certainly some self-introspection and reflection that needs to happen as well, that it's long work, it's hard work, but there has to be a genuine compassion and commitment to walking this journey, because otherwise people will see it for what it is. You can't just go out and recruit some additional board members of color to say, we believe in diversity or we're trying to be more equitable. You can't hire just your chief diversity officer or even, put a slogan up. People will easily see through that if it's not really coming from the right place. So that's the only other thing I want to add to anyone who's, beginning this journey. We're coming close to the end, and we want to leave time certainly for some of our guests to engage with you as well. I want to thank you all for this time this morning. I am so honored to be in your presence, this distinguished panel here, and hope that we're able to do this again at some point. I'm going to turn it back over to Mari, who's going to kind of navigate the questions from our audience. But I just want to thank you all. Let me put my little reaction hand clap up. Oh, we don't have it. I just have to really clap. Yeah.
Karen, can I say one thing too, as we're doing this? This work can be uncomfortable and nobody's perfect and we don't all have the right answer, but this work is also messy. And if you're uncomfortable, then that's a good thing. That means we're heading in the right direction. So I just want to leave people there who think this is going to be comfortable work. It's not. And you can't be afraid to step out there, to get into the messiness, and that it's okay to be part of that, because that's the only way you're going to have the hard conversations. And so I would just say that.
Indeed. Thank you, Serena. Mari, I'm turning it back over to you.
Thank you, Karen. So I'm going to ask a few questions from the chat box up until almost 10 o'clock. So I think I'm going to throw this one to you first, Nadia, and then others can weigh in. So how are you holding hiring managers and others accountable?
Yeah, so I mean, I will say right now, I'm currently just contracting or consulting, so I'm not working full-time anymore. But when it comes to holding hiring managers and folks accountable, I think the most important thing is awareness and actually education. And so in my experience, what has happened is that people don't even know what is and isn't allowed. And so we can't say, hey, you can't ask her about X, right? If people don't know. And so one of the things that I've always done in my work is ensure that there's an awareness of what is allowed and what isn't allowed. And so that education, that investment in that awareness is really, really, really important. And then closing that loop after the interview process in talking about interviewing, who did you choose and why? And then helping identify language that is appropriate as to why that person was choosing or not appropriate. So culture fit, we're going to throw that one out the door right now, unless you can break down what exactly that means. We're going to talk about skills, competencies, whatever specific thing you're really focusing on. So I think awareness is step one, and then constant conversation about what that actually looks like.
Thank you, Nadia. Anybody else want to add to this question? Okay. So the next question is, when a diverse qualified pool is in place, how can an organization overcome the biases that results in these qualified diverse applicants being consistently eliminated from consideration of being hired? So anybody want to start?
So I'll first just acknowledge that I don't fully grasp the question, but this is what I understood being asked, that they are experiencing a consistency around having diverse applicant pools, but they're not seeing the same consistency and seeing the results of diverse people, and I'm assuming you mean people of color, being hired. And if that's the situation that you're facing, I would do a couple of things. I would, one, call that out and ask for some further information about, what decision was made. What was the decision sort of paradigm that resulted in those choices? If it's a pattern in a department with a particular manager, I would trouble that manager can continue to make those choices. We have interrupted hiring processes. We have witnessed patterns in departments, and we have disrupted who participates in hiring processes as a result of that. So if there is a pattern that is easily, whether or not it's easy is irrelevant, but if there's a pattern that can be identified that needs to be named, it should be named and interrupted. And a new process needs to be created to replace the one that continued to result in the pattern that you're interrogating.
And can I add to what Sharifa was saying? First of all, let's identify what diversity is, because diversity is not just having a woman on your panel and then making sure that it's an all white panel, but with white women or LGBTQ. Are you talking about a racially diverse panel? And again, it goes back to intentionality. And again, you have to interrupt them and start over, because sometimes the process is long. I know at the state, we have long processes for hiring, but it's about getting it right. So I ditto what Sharifa has said. It's really important, again, to be intentional and then also identify, again, is it racially diverse or is it just diverse because you have same people but different backgrounds?
And I'll tack on like what I said earlier is, what is the awareness of the people? Like, do they even realize what they're doing? Like what's happening? And then the second part of that is like, why did you pick this person? And really pushing that conversation forward. And I think that's when my hiring managers have gotten a little scared of me, because I've been like, well, tell me more. And so break that down and break that down. And so because when you start to break that down, you do start to pick up on a bias or a non-bias. And that's what's going to start to help to do that work. So making sure people understand, calling it out, like Sharifa said, but also saying like, well, why did you pick that? I'd really like to understand, because if I'm going to continue to serve you as your recruiter, business partner, I need to know where we're going and why we're going in that direction.
So this question is for Serena. How do you balance wanting a fair and unbiased interview process with the length of time it takes to hire people into state government positions? Well, it's not slow, is it? The longer it takes to actually to hire somebody, the less likely financially disadvantaged people will be able to wait the time it takes to start working for the state.
Well, first of all, I don't know if they're financially disadvantaged. I have no way of knowing that. Secondly of all, it doesn't matter about the length that it takes. It still has to be a fair and unbiased interview process. And it goes back to what Nadia said, let's look at the why, and Simon Sinek even said, let's start with why. Why are you doing it this way? Why are you hiring this person? And when you start with the why, that helps you get to the what for, you know what I'm saying? So again, it's being intentional. It doesn't matter about the length as long as your process is fair and unbiased. It could take 6 months to a year. And I know sometimes at the state it does there because maybe the interview wasn't right. Maybe the people that you had on the interview panel wasn't the right folks for that panel. It wasn't racially diverse. And we need to be intentional about that, making sure that it's racially diverse. Our panels are, and making sure that you have a racially diverse people that you're interviewing for those positions. And then also looking at the questions and making sure that they're unbiased when you're asking those questions and doing that. So all those things are really important. And I will say, because I've only been in this position, I don't even know if it's been 3 months yet, that these are things that we're just now starting to work on. And so we're going to get there, but it takes some time. It's not going to be yet today, and it's not going to be tomorrow. It could be 6 months from now, but I'm going to be strategic about how we're going about doing the work and what we're going to be looking at and making sure that it's standardized, because we have to be in order to make some changes.
Thanks, Serena. Sharifa, this question is for you. Have you had any issues with the private or invitation-only affinity groups, specifically with folks who are not allowed to join a specific group?
Yeah, so the short answer is no, largely because, obviously a private group is unknown. So people don't even know that they're not being invited to attend them. The reason why I have insight to some of those groups that are not known is because I'm the director of equity, and I'm the staff person who's a resource to a group if they want a resource, because they don't even have to tell me. But sometimes people have questions right before they start a group, and they come to me to sort of tease out those questions, to sort of learn what the rules are, because they don't really trust that there are no rules. So once I reaffirm to them that it's up to them how they want to proceed, they then inform me if they're going to go public, if it's going to be private, et cetera. So typically in those situations, the people who are not invited don't even know that there's a space that they're not being invited to. Now, if you're asking for those groups that are more public, like the People of Color Affinity Group, there's also a white anti-racist group. If in fact you're not a person of color and you want to enter into that space, we haven't had that approach happen. Not that it doesn't approach in other spaces, but it hasn't happened at OSF yet. And for some of the other groups, they actually bring in what they call allies. So it's not solely the people who identify in a particular way. If you want to join that space and support in alignment with, that's also invited by some.
Thanks, Sharifa. Charlie, this one's for you. We'd love to hear more about Charlie's comments on making affinity groups or activities more accessible to all employees. My company has a large group of employees who work in the field, and we have struggled to find ways to include them in this work.
Each of the caregiver affinity groups have three focus. One is caregiver engagement. Another one is community outreach, and then how can we improve the patient experience for the communities that we serve. And so what we found is there are a couple of groups that are more virtual than in place, and so they participate basically throughout the system, meaning Oregon, Alaska, and Washington, to some of those conversations. And we try to record some of those meetings, specifically town hall meetings like we had on voter suppression for three of the groups, our Blacks and Allies, our Latino and Allies, and then our Pride group. And so again, if it's an educational engagement with our employees, they can go back and listen to those recordings. If it's a community outreach or an opportunity to volunteer, they'll look for members that are in those particular communities to come together and participate, like our Pride group. Last year was the first time that the Pride groups in each of our major communities were able to participate in Pride events and parades. And so again, we try to give them examples of things that they can do, but ultimately it comes to creating enough membership in those exterior communities, if you will, or smaller communities to get people to get involved. It's difficult because, like I said earlier, we've got two cultures, a corporate culture and those that are at the bedside or in the clinics. And so getting those folks engaged has been one of our biggest opportunities and challenges.
Thanks, Charlie. So,
You're
Dr.
welcome.
Edwards, this one is for you. What are the best metrics to use when wanting to measure culture change?
I'm sorry, were you directing that to me, Mari?
Yes, yes.
Oh, I'm sorry.
That's okay. What are the best metrics to use when wanting to measure culture changes?
Well, certainly what's obvious certainly is who's represented, right? If you have a good a cross section of representation, I think that is very helpful. Then you're inviting different views and different perspectives. But culture to me is also behavior and how decisions are made, how information is communicated, how people are welcomed. So I think those are all things for an organization. If you want to look at policy, if you want to look at communication, if you want to look at decision making, certainly representation would be ways in which I would kind of try to track to see if we're making progress on cultural change. For me, it's more the behavior and how we interact with one another. Is what I would be more focused on, and not so much numbers per se, but really it's the behavior and how the organization kind of functions, how we operate. You should be able to see a difference in the climate, if it's a more welcoming climate, if it's a supportive climate, if diversity and equity isn't new to anybody anymore. Certainly we have made progress in changing the culture.
Thanks, Dr. Edwards. We have 1 minute. Does anybody, one of our other panelists, want to weigh in here? Nope. Okay. Well, that will be our last question. So I want to thank Nadia, Sharifa, Charlie, Serena, and Karen for sharing their expertise with us today. I took a lot of notes. I hope all of you got a lot out of this panel. And to all of you here, thank you for joining us and for being a member of Partners in Diversity. And I guess I'll turn on my camera now so you can see me. I hope today's conversation inspires you to make meaningful changes within your organization. Diversity and equity work is a continual process, as our panelists have said, and that we must all commit to it for the long run. I look forward to seeing you in the future at one of our upcoming programs and maybe at Say Hey. And finally, I'd like to take a few minutes for you to send us your feedback. A survey link will appear in, as soon as you leave the webinar, it's going to pop up. So it's also posted in the chat box. Your feedback is very important to us. So again, thanks for being here today. Take care and be well.